Hello, if you're dealing with neck and shoulder problems and you've tried pills, rest, exercise, even prescription medications and they haven't worked, I want to talk to you. My name is Dr. Chad Schaefer. I'm a physical therapist here in Troy, and I have literally helped thousands of people get rid of and ease and self-manage their neck and their shoulder issues. Now, a lot of people that I work with have a lot of the same concerns that you may have when you're watching this video. One of the biggest concerns that people have is, how did I get this? What am I dealing with and how did I get this? And how can I avoid not having this in the future? But the first thing to understand is, how did you get this and how can we prevent it on your own from coming back? That's number one. Number two is, once you have it, what do you do? A lot of my patients will report to me that they have a long history before they actually reach me. They tell me that either their neck pain started a month ago or they've had it for 6 months, 8 months, maybe even years. And the typical course with people is what they'll do is, having neck and shoulder problems, as a lot of us do, we'll ignore it, we'll rest, maybe take some medications, and again, most of the times that doesn't work. At best, and if you're lucky, it'll help with the symptoms and it'll mask the problem, but it won't actually give you a good solution once that chemical wears off and dies off, such as an over-the-counter or a prescription medication. So what a lot of patients do is they'll go to their doctor, they'll get pills. The doctor will say, I have a couple minutes for you, here's some medications, try some rest, see you in 6 to 8 weeks. Honestly, that's unacceptable, and I want to be able to change that for you, because neck and shoulder problems shouldn't linger for months at a time. They shouldn't linger for years at a time. And one of the biggest things that I struggle with as a physical therapist, as in my own body, neck and back pain, I don't have any fear about moving, about working, about lifting, because all those things are actually good for your body and they're going to help keep you mobile, active, and strong. And what I struggle with is portraying that to people and patients on a day-to-day basis. So if you're watching this and you get anything out of this video, know that your problems are going to get better. It's not going to be life-ending. You don't have to live with it, and you don't have to rely on medications, whether over-the-counter or prescriptions, and you can stop worrying about considering surgery. Now, I want to help you in a couple different ways, because I have a couple different options for where you're at right now as far as deciding how to deal with this. My first option is for people that are pretty skeptical. Maybe you've tried physical therapy in the past, or you've tried some other sort of conservative care, and honestly, you've probably been let down and there haven't been any results, and you're still dealing with pain. This is called a free report, and if you haven't got it already, it's called 6 Ways to Decrease Neck and Shoulder Pain. Now, along with the 6 ways, you're going to get all sorts of cool information in there, ways to contact me so I can give you some more information if you need it, but it's going to really be the stepping stone for people that are concerned, they've been let down in the past and they're not really sure where to start, or if they just have to live with it. So the free report is there for you. My second option is for people that maybe you're watching this video and you're kind of interested, but you're not really sure, still a little bit skeptical. Well, this is called a discovery visit. Now, my discovery visits are for people that want to come into the clinic or simply do a telephone discovery session on the phone. So unlike other practitioners, people that are not giving you the time of the day that you need to actually solve your problem, I want to give you the discovery visit completely free, and it's an unlimited offer. You can do it whenever you need to do it on your time, and we need to figure this out so you can just get rid of it and move on with your life. So this phone call is a 10 to 15 minute conversation to see if I'm a right fit for you, as well as you being a right fit for me, because if we're not on the same wavelength as far as where you want to be and your goals, then you may have mixed results as far as what you're expecting. So expectations is another big thing. I really love empowering patients to heal themselves and get onto the right track of movement and being able to get back to things that they love. Even if it's just simple things like going for a walk for 10 minutes or being able to get dressed or take a shower with less back pain or less stiffness, or just making those big grunting noises when you move, because you're so stiff and you're just having pain, to be honest. That's what a discovery visit is there for, to see what it's all about and to see what you can finally discover so you can get rid of the neck and shoulder problems, so you can just get back to your life and get ways to ease your symptoms. Even if you found 10 to 20% relief, imagine the things that you could achieve with that. Even if you have You come and you're 8 out of 10 pain, and now you're 3 to 4 out of 10 pain, and you can go to the zoo, or you can finally shovel the driveway, or you can do the laundry with less and less symptoms, stiffness, or pain. That is huge, and that way you don't have to rely on medications for anything. You don't have to rely on possibly having surgery. The only person you need to rely on is yourself, because you have the potential to heal yourself. You just need someone to help you guide you through it. My next option is a full evaluation. So the full evaluation is just with me, myself, and I, as well as you, the most important person in the room. Because I want to understand 100% what you're going through, where the source of the symptoms are coming from, and how to get rid of it so you can just stop worrying about it and get back to the life you know you deserve. Now, we offer completely comprehensive packages that approach your movement, your stiffness, your pain, and definitely getting away from those pills and letting you move easier and with less symptoms. So if any of those options feel like that's the right fit for you, please sign up for one of them. Again, we have the free report. That's for anybody that's skeptical, not really sure about if we can help you or not, been let down in the past. We've got the discovery visit. If this information sounds kind of cool to you, but you're not really sure, give me a call. Let's chat. Evaluation, if this is awesome, you want to do this, let's jump on board. Let's take care of this today. Let's see if I can't find some results because you're just honestly sick of dealing with it. Those are all three options for you. So again, if you're sick of living with your symptoms in your neck or your shoulder, you've been told that you've had bone-on-bone arthritis, maybe you have a disc bulge or a rotator cuff tear, and you've just been told, you have to live with it, it's old age, or it's only going to get worse. That's absolutely unacceptable, and we need to move past that so you can get back to the life you know you deserve. Again, my name is Dr. Chad Schaefer, physical therapist here in Troy, and I hope you have a great day.